As I said, we really are focused on getting children back to school in a safe manner. So I'm going to turn it over to Dr. McCullers to give an update from his perspective, one as an infectious disease specialist and also as a pediatrician, and then we'll open it up to questions. Thank you.
Very good. Well, thank you, Dr. Haushalter, and a pleasure to be here with you this afternoon. I'm Jon McCullers. I'm the Chair of Pediatrics at UTHSC and the Pediatrician-in-Chief at Le Bonheur. And I know the question on everyone's minds right now is, what are we doing about schools and about kids going back to schools? And probably the most commonly asked question we're getting right now is, should schools be open? Should schools be closed? Should parents send their kids to school? Should parents keep their kids home? And what we can say to that right now is we're in a status as a community where we have high levels of community transmission of this virus. What that means is, from my standpoint, there is no good answer to this. We know that if kids go back to schools, we're likely to see transmission within the schools, perhaps transmission on to faculty or staff, and perhaps transmission back into the homes to parents or grandparents. So we know that there are health issues associated with the decision to open schools and for parents to send kids back to schools. At the same time, we also recognize that having kids in school, having face-to-face learning, is the best way for kids to learn. It's very important for their socio-emotional development, very important because that's where they get a lot of nutrition in terms of school breakfast and lunch, as well as their physical activity through the PE programs. We also know that kids learn better face-to-face and when they're there with their peers and can interact in that way. So I think both choices both choices may be bad right now. You know, keeping kids from home, we know that there's going to be issues with that. Sending kids to school, we know there's going to be health issues with that. So from that standpoint, and from the standpoint of being a physician and an educator and working with UT and Le Bonheur, our advice right now is that it is really incumbent on the school systems, on the schools themselves, and on the parents to make those individualized decisions. Some schools may be better able to deal with virtual learning than others. Some may be better prepared to have in-person learning because of the facilities. On the parental side, some parents may be better equipped for virtual learning, and some may need to send their kids to school because of issues with childcare and the need for nutrition and so on. So I think an individualized approach to this is best.